Hi, this is Pat Duckworth, the founder of Smarter Menopause, and I'm so delighted today that my guest is Dr. Mache Seibel. I'm delighted because I've been on his mail out list for a few years now after I read the Estrogen Fix, and I couldn't wait to talk to him. So, Dr. Mache has helped over 10,000 women feel better and look better in menopause and beyond. He's a 25-year Harvard Medical School faculty member, a founding publisher of the Hot Years magazine, and the #1 digital magazine for midlife women, and best menopause blog of 2020 blogger. Fantastic. Before transitioning his career to focus on menopause, Dr. Mache was a leading expert in infertility and performed some of the first in vitro fertilization successes in the United States. Dr. Mache has published over 200 scientific articles and 17 books for both professionals and consumers, and has received multiple national awards for patient education, research, and innovation. He is board certified in gynecology and reproductive medicine and an NAMS certified menopause practitioner. He is a sought after speaker, consultant, and menopause coach. So you understand why I wanted to speak to him today. So welcome, Dr. Mache. It's so lovely to be talking to you.
I'm just thrilled to be here with you, and thank you for inviting me.
So let's get right down and into it. So you started out your career working in infertility and then you moved to menopause. What led you to specialize into menopause?
Well, for me, menopause is rather personal because my transition from a reproductive endocrinologist focusing primarily in the fertility world into the menopause arena came when my wife had surgery that threw her into early menopause. And she was facing this only months after the Women's Health Initiative came out and incorrectly stated that hormones can cause breast cancer and heart disease and a whole lot of other things that have now been really largely disproven. But when she was looking to get treatment with hormones because she was in surgical menopause, her doctors were very reluctant to treat her.
Mhm.
And so I transitioned at that time so that I could help her get the information that she needed. And so I say I moved my career. I used to do sperm to term, and now I do womb to tomb.
I love it. This is such important work because women get so confused when they're researching their approach to menopause. How did you help your wife? What decisions did she have to make?
Well, the biggest one, of course, is the one that every woman has to make as she approaches menopause, and that is, will I consider hormone therapy or not? And at the time, I live in Boston. It's a major medical center town. And the whole city transitioned from all the doctors just giving hormones to everyone to asking for informed consent to give it to anyone.
Mm,
And literally, oh, just like that, thousands of women were throwing their hormones in the waste bin,
mm.
and doctors were just saying, I'm not sure that it's so good for you. Maybe we should wait. And there was a lot of hesitancy and cause and concern at that time.
And how can women give informed consent on something like that when there's so much conflicting evidence, really? It's,
Well, you have to spend a lot of time with them and explain the
yeah.
facts and the data, and also explain the evolution of thinking that's come about because the concept of estrogen as just one component of menopause, there's many components, but
Mm,
this cornerstone component has really been a pendulum swing.
mm.
And what's happened is estrogen's been for everyone, and then no, and no, it should be for no one. And then it went back to, well, most everyone. And then, well, I'm not so sure. And now we're back again to it looks like it's pretty good now that we have lots more data.
And lots more options, but we'll get there anyway.
Yes,
So,
indeed.
the women who come to see you now, what's the average age of women coming to ask for your advice? And is there any particular symptom that leads them to come and talk to you?
Usually confusion is the symptom that brings them to see me. They don't know what the heck they should be doing. The demographics are kind of wide.
Mm.
Uh, there's an older group of women who come to see me not because of themselves. They come to see me to ask about their daughters who are
Oh,
entering menopause and are confused. And the mothers have stayed on hormones throughout this time and feel great, look terrific. And the daughters say, oh no, I could tough this out. So there's that group. Then we have a second group that are entering in, and they are, late 40s, early 50s, and they have been to other doctors who have been concerned or haven't been able to answer their questions to their satisfaction. So they're coming for clarification. And then there's a whole another group that are the younger women who are going to have surgery that's going to throw them into menopause, like my wife, a previvor,
mm.
as they call them, not a survivor who's had cancer, but a previvor who's trying to prevent cancer and has surgery to improve that. And so there's, buckets of groups of women who come through trying to get information.
And how about women who have premature ovarian failure or primary ovarian insufficiency? All these really horrible terms around going into early menopause. Do you get to see any of them?
Oh, yes, I have patients that are in their 20s in
Mm.
menopause. The thing is that a lot of people don't realize that between 5 and 10% of women go into menopause. They're in menopause before age 45, and that's, of course, called early menopause. And then between 1 and 4%, depending on which studies you read, so between 1 in 100 to 4 in 100 women enter menopause before age 40. And let's not forget that the symptoms start, as much as a decade before, but certainly 3 to 5 years before, often, typically, and up to a decade before. I not too long ago saw a woman who was in her late 20s, about
Mm.
28. She was having very irregular periods. She was one in the financial sector in Boston, really a powerful woman, up and coming. She wasn't married, but she had a significant other, and she just wanted to get some help with period regulation.
Mm.
And in the process of sorting this out, I quickly figured out that she was, in fact, entering into early menopause. And those are what I call a box of Kleenex discussions,
Yeah.
because it's one thing if you lose you throw your back or you twist your knee or something like that happens. But to have that kind of a diagnosis thrown on you in your 20s is just overwhelming. And it certainly was for her.
Yeah, and I think, you've touched on a spot there of women who have delayed pregnancy because of their careers, because of their, home situations, and then find themselves moving into menopause, which is why I think it's so important that we're educating younger people about this.
Oh,
Even
absolutely.
school
All these
children.
women that are trying to wait. I have a very short conversation for women who say, I'm waiting for the right time.
Yeah,
I would say there is no right time.
yeah,
There is this time, and this is the time you should think about it. Because if you're waiting for the right time, it probably will never come. And I say that from personal experience and professional experience. Life continues. As John Lennon said, life's what happens to you when you're making other plans.
yeah.
And you just have to do what the things are that are really important to you, and the other stuff will sort itself out.
Absolutely. So, my next question is, so if a woman in her mid to late 40s comes to see you, she's starting to experience symptoms, she thinks it might be menopause, what are the sort of questions you're going to be asking her? What sort of advice are you going to be giving her?
Well, the first thing is going to be to see what her symptoms are.
Yeah.
I divide symptoms into two categories. I call them the noisy symptoms. Those are like the hot flashes and the mood swings. You just can't miss those. And then there are the silent symptoms, and those are things like osteoporosis or thinning of
Yeah.
the bones or heart disease. Those things are going on. We just don't know it until it absolutely comes to a head and we're in a medical circumstance. So there's also, for women in that age group, I would want to know what their symptoms were first, of course, but then I would want to know, could it be something else?
Mm.
And a lot of times, women who have belief that they're in menopause actually are having issues with diabetes or
Mm.
low thyroid hormone or other metabolic conditions. And so you've got to first, everything that looks like menopause isn't menopause, though it's the most likely thing. But before we go off in that direction, let's make sure what we're talking about. And then, if it's appropriate, then they can get hormonal support, they can get emotional support, they can get nutritional support, they can get stress reduction support,
Mm.
they can get exercise support and sleep support, which are the
Yeah.
areas which usually go haywire. And really look, as I say, look at the sum of you and not just some of you, because you're the sum of all these things that are happening in your life. And if we go try to drive our car with one flat tire, it doesn't go very well.
Yeah.
So it's important to look at the person and then give her appropriate suggestions for options that she can take in the area that need to be fulfilled the most, being mindful of the other areas still need not to be neglected.
Yeah. So would you be doing hormone tests at that stage? Would you be
Oh yes.
seeing? Okay.
Yeah,
Yeah.
you
So
have
you'd
to
be.
do hormone testing in the beginning just to know where you are. But I would, as I said, test for other things as well as for menopause, because I want to make sure that I'm treating the right condition. Or there's possibility it could be more than one thing at the same time.
So yeah. What are the sort of questions that you hope they'll ask you, or what do you want to answer for them?
Well, I would try to understand what's their biggest problem or what's
Mm.
their top three, let's just say, but usually it's one or two things that are most important to them at the time. And I'd like to ask, what are you worrying about? What's the thing that's got you up at night about this whole set of conditions? And it might be how they're going to look, how they're going to feel, or it could be how they're going to treat it. It could be how others will treat them. There's a lot of things that are going on in a woman's mind because society is not that kind to women after a certain age. I mean, the focus for men and women is to look young, look good. And the truth is, that's all well and good, but our lives are going to extend beyond our use if we're fortunate. And the goal is to embrace those times of life because in this moment, the women are usually self-sufficient.
Mm.
They are usually have a great deal of wisdom. They have much to give and much to offer. And it's a time to look inside and say, wow, look at me, all that I can do and give and have to offer to the world. And say, yes, it took a while to get to this point. I wasn't born smart.
Yeah.
I had to get smart. And so that's not a bad thing. And so we embrace these things and say, how can I, though, feel comfortable? How can I maximize my health so that the years ahead of me are optimized, my health is optimized, and I can go on to be the most productive and happy person it's possible for me to be? And so I'm trying to figure out how to intercede in a way that I can help them start thinking about beyond this, because menopause as a symptom is a symptomatic experience, is a window of time, just like puberty was a window of
Mm.
time. Eventually, women get through puberty.
Yeah.
It's tough, but you get through it. And menopause, of course, hormonally is just like puberty, only backwards beyond.
Yeah, and that's so important. The other thing is that, there are more women in this menopause age group in the workplace than there have ever been before. And
Right.
they're reaching higher levels because with changes to legislation around maternity leave, and there are more women who are carrying on with their careers, getting to higher levels. The last thing they want is to be stopped by this. They don't want to be sitting in that important meeting and having a hot flush and everybody thinking they're embarrassed or nervous. Or so do you get many kind of career women who are saying to you, I just can't do this?
Well, many of the people that I see, of course, are career women.
Mm.
And the, the problems they face are multiple. Number one, um, the culture of businesses is not to talk about it.
Mm.
Number two, the culture of women is not to be labeled as menopausal
Yeah.
because anytime they're late, anytime they have a little bit of a myth or anything that goes awry and say, oh, she's in menopause,
Yeah.
they are concerned that they'll be overlooked for something.
Mm.
And they don't really want to go and talk to some young person in human resources that has no clue about menopause and views them as just somebody who's looking for an excuse to sleep in or for why they forgot to turn the report in at 10 o'clock when it was due or whatever it is. So there's I think that there's much need for education in the
Mm.
workplace. And there's much need for education of the women in the workplace so that they are empowered with the knowledge of their bodies and what's going on and what's possible. I mean,
Yeah.
there's a much could be done.
Yeah, and of course, estrogen is such a powerful hormone and it's not just affecting your reproductive system. Could you just
No.
talk a bit about the effect it has on your whole body?
Well, estrogen is one of those hormones that has an effect on almost every part of your body.
Mm.
For instance, as menopause happens, a lot of the uh, mood changes and things that happen is because lower estrogens or erratic estrogen levels are affecting the brain.
Mm.
And estrogen causes serotonin in the brain to increase, and it causes a lot of things that have to do with the speed that one little neuron in the brain can communicate with the next one. So, people get clumsy, people get
Yeah.
moody, they emotionally get clumsy
Mm.
because the synapses aren't working as fast. Now, for many women, fear that they're going to be having dementia.
Yeah.
This is a very big fear. And the fact of the matter is that those fears are not universal, but they are prevalent.
Mm.
And that for most women, all of that can't remember where I left the keys, I can't remember where I parked the car, I forgot to pick up the kids. All of that stuff is normal and will pass for almost everyone. The other thing is that the mood changes, the anxiety, the sadness, all of those things are normal, they're common. It's a hormonal shift in the brain. So those too will pass. And
Mhm.
you just have to allow yourself the freedom to get seen, maybe get treated, but also to realize that if you choose not to, that it will pass almost always. I mean, if you're a woman with history of PMS that's terrible, premenstrual syndrome, or if you have bad clinical depression in the past or postpartum depression, you're at more risk. And so
Mhm.
as a result, you need to be mindful that you may be having a relapse to those earlier conditions. But menopause per se causes every woman to feel moody. There are changes in the heart rhythms. And
Mm.
so as a result, women will often feel palpitations and think
Yeah.
they're having a heart attack. So they may have issues uh, in their bladder and have a more
Mm.
sensitive bladder. The tissues depend on the estrogen in order to keep firm. And with the lack of hormones, it's possible that the tissues will weaken and organs may drop a little bit, or it may be that the bladder wants to eliminate urine more often, or coughing and sneezing may cause a little wetness to happen. These are common things for
Yeah.
women. There's treatments for all of these things. Intimacy may get different, both
Mm.
from the head part, like I'm not in the mood, down to the bottom part where it hurts when you do that,
Yeah.
you know? And so if you feel like your vagina is the Sahara Desert, it's not going to be a place where you want to have intimacy. So, but there are treatments for all of that, and some of them quite simple. Uh, Bones get weaker.
Mm.
And so one has to check their bones. Arteries can get narrower
Mm.
because of fat deposits. And so it's important to have an ongoing look at the person's heart because women are 10 times more likely to die of heart disease than they are breast cancer. And yet they're 10 times more worried
Yeah.
about breast cancer than they are about heart disease. And if you're 50 and you're well, you're just as likely to die of a break of your bone, a complication of osteoporosis, as you are of breast cancer.
Mm.
So it's important to realize, again, the sum of you.
Yeah.
And the thing that I feel is important is that estrogen, and I'm not pushing estrogen, I'm just talking about the question you asked me,
Mm.
but estrogen will address all of you and go to all those cells. So if you choose not to take estrogen, that's okay. But your symptoms may still come. And so, for that reason, you have to really have a kind of systematic approach to taking your mind, your body, your spirit, and you have to look at each part of you separately because there are things to be done, but you have to look at them one at a time. You need more of a
Mm.
checklist to make sure you're covering everything because there is not the one thing that's going to more or less help you in all of those areas.
A lot of women at this stage of life, excuse me, are living quite stressful lives because, they're dealing with the kids who are leaving home, they're dealing with elderly parents, they're dealing with their partner's stuff, they're dealing with, their own careers. And sometimes there can be big traumas at this stage of life as well, perhaps losing a partner or losing parents.
Right.
And can you just say a little bit about what can happen there, that what the trauma can bring about in the reproductive system?
On your toes. A little bit of stress is a good thing. It kind of keeps you sharp. As a matter of fact, if you have nothing going through your veins at all, you might fall asleep during that talk. But when that stress is chronic and the things that go on all the time, it increases your risk for high blood pressure, increases your risk for diabetes, it increases your risk for heart disease, it increases the risk for Alzheimer's disease. There's just nothing good about chronic stress except making it stop.
Yeah.
And I think that we have to look at things as a cycle. One thing affects the next thing, affects the next thing. And the goal is to intervene.
Mm.
If you're stressed because you're exhausted, work on sleep. If you're stressed because you don't get any exercise, which would help mitigate some of those outcomes, get some exercise. And let me tell you, I realize you may not be ready for a marathon, but I tell you this, if you tell me you can walk to the corner, that's a start.
Yeah.
If you tell me you've done it 3 days in a row and you can walk around the block, that's taking it to the next level. If you can walk around the block, maybe you can walk, half a mile or one and then a half a mile back. That's making progress. So don't have to eat the whole elephant at once. Just take it a bite at a time.
Yeah.
So, and always keep looking at what you eat because you
Mm.
will not believe until you read the labels what's in it.
Yeah.
There's salt and sugar in everything, in the bread that you eat, in the pasta sauce that you eat, in just about every food that you buy at the supermarket. If you'll take a moment and read the label and see what's in it, it'll do you good. And then know what you're supposed to get every day. How many milligrams of salt? How many grams of sugar?
Yeah.
How much calcium do you need? Are you getting it? And make sure for those things, and then you'll be surprised and you can make changes.
I knew we would get along, Dr. Mache. You're singing from the same hymn book as I am. So, I've got a last question. Some women ask me about bioidentical hormone therapy, which here I think is more new than it is in the States. Could you just say a bit about that?
Yes, I think it's very confusing, and so I'll try to make it as simple as I can. Uh, Bioidentical hormones really weren't a very big thing until the Women's Health Initiative came out.
Mm.
And as a result, there were about 80% of women threw their hormones away. And as a result of that, guess what? Those women were miserable. And then certain celebrities and others came out and said, oh, this is safe, this is good, this is great. So they came up with the concept of bioidentical hormones, and everyone had a finger in that pie. The thing about it is, let's talk about bioidentical. What is it? It is something that is structurally the same as the hormones that are in the woman's body. Now, people associate bioidentical hormones with compounding pharmacies. In
Mm.
other words, the only place you can get bioidentical is in a compounding pharmacy where they can make all that natural stuff.
Mm.
First of all, it ain't natural.
Yeah.
The only plant that a bioidentical hormone comes from is a chemical plant.
Mm.
Every hormone is synthesized because the body cannot have enzymes, doesn't have enzymes to break down the plant content to make hormones. So it's all manufactured. Bioidentical comes from the compounding pharmacies, but the same bioidentical hormone is also available in the traditional chain store drugstores.
Mm.
The difference is the ones that are in the chain store drugstores are FDA in the United States, Food and Drug Administration regulated, whereas the ones in the pharmacy are not,
Mm.
in the compounding pharmacy.
Mm.
Now, the compounding pharmacy has a very good advantage. If you need a mix of A, B, and C, or a little more A and a little less C, they can make it for you like that. And they make it there right for you one at a time. But because it's one at a time, it's not regulated. And I use the analogy that if you were to put some candies, some chocolate chips into vanilla ice cream and stir it up, and then take a scoop out, some scoops will get a lot of chocolate chips and some scoops will get less. And that's the problem with the compounded hormones. They may fill the prescription to perfection, but you may and often do get a little different amount of hormones, typically more estrogen than was prescribed, and typically less progesterone than was prescribed. And the outcome of that is that there are reports now in the literature of women getting uterine cancer from
Oh.
compounded hormones. And the reason is because they think it's all safe and it's
Yeah.
safer. Matter of fact, on studies of women who look at, their question in the survey, do you think they're safer? Well, a lot of women think they're safer.
Yeah.
But a lot of them, a third of them have no idea. But some
Mm.
of them, a lot of them think it's safer. It isn't safe. There are no studies that say the ones in compounding pharmacies are safer or better. And I'm not saying don't use them, but I am saying to you, if you use them, you must have your healthcare provider check your uterine lining to make sure it's not building up and turning into precancerous cells, because the chances of that are real. They're small, but they're
Mm.
real. And it doesn't happen in the chain store, drugstore formulas because they have the amount that's ordered exactly given to you.
Yeah. Thank you. That is really useful. I love that explanation. Thank you so much.
Sure.
So I could carry on talking to you for hours, but we're going to have to stop. So um, your book, The Estrogen Fix, which I think has got so much useful information in it.
Yeah, I have it
It
here.
just happens.
Just happen to have it.
How useful is that?
Always keep it in my wallet.
So for those of you watching who really want to understand more about estrogen, then it is a really useful book. And Dr. Mache, if women want to find out more about you and about your magazine, how can they do that?
Well, my website is drmache.com, drmache.com, drmache.com. And also, if there are people interested in looking to do coaching with me, then I have another website, which is menopausecoaching.com. But if you go to drmache.com, it's all there.
Thank you so much for your time today. It's been really interesting. And as I say, I believe a lot of the same things that you do. So it's great talking with you.
It's
And
been a pleasure.
hopefully we'll have a chat again another day. Take care now.
Best to